We need 2 classes for this cancer. First of all, just an introduction, then we will enter into that topic. Then next day, we will discuss in detail. Okay, we need 2 classes. Okay, today and tomorrow. Okay, so can we
Yes.
start? Okay,
Yeah.
so cancer, you can see from this picture, it is related to a what? What is meant by cancer? What's the word meaning of cancer?
Zodiac sign.
Yeah, okay. That means before entering into that definition, which are the common cancers? Which are the normally common cancers present in? Okay, can
Uh,
you name it? Common cancers normally.
breast
Hmm?
cancer.
Yes,
Breast
breast
cancer.
cancer in female. Then
Uh,
oral cancer. Nowadays, oral cancer is increased a lot. Okay. Okay, we have so many facilities, but we can't identify. Sometimes there will be a small patch or white spot in mouth. Okay. Hmm?
yes.
Okay, we normally we avoid it. Then it will convert it into oral cancer is dangerous. Okay, it can enter into it can spread to a very large extent. It can be spread. Okay.
Yes.
So the first one is oral cancer, then pharynx is only 10%, esophagus is 6%. There is lung cancer also, it's 30%. Hmm? Next
Yes, ma'am.
important area is colon and rectum. Okay.
Yeah.
Next important area. Then in developed countries, oral cancer is very low, 2%, because oral checkup, regular oral checkup will be there.
Yes,
Okay.
ma'am.
In our country, when we visit our dentist, only if there is a pain.
Oh, yes, ma'am.
Yes, otherwise we won't regular cleaning or anything. We avoid it. Yes,
Yes, ma'am.
in
Yes.
India, but in developed countries, they usually visit their dentist. So family dentist will be there.
Yes, ma'am.
Okay, okay. Then regular checkup will avoid all these problems.
Yes, ma'am.
Okay. In our country, in India, the oral cancer is almost is equal to 30%. In developed country, it is equal to 2%.
Yes, ma'am.
Okay. Then in cancers in female, in our country, the cervical cancer is 30%, oral is 18%, breast cancer is there. Breast cancer is normally detectable if there is any kind of growth. We must check. Regular checkup is essential. Nowadays, they remember as routine checkup should be there in breast. Yes,
Yes, yes,
if
ma'am.
there is any kind of small growth, if it is moved or it is fixed, we must check up. Okay.
Yes.
Personally, we need a regular checkup. Okay. Then if there is any problem, we must consult a doctor.
Yeah.
Okay. And sometime it may be a fibroid.
Mm.
Okay.
Yes, ma'am.
Then there will be after biopsy, no problem. It's a fibroid adenoma.
Mm.
Okay. But some cases, there is a chance to convert that fibroid adenoma to cancerous, malignant
Yes, ma'am.
condition. Okay. Then in developed country, breast cancer is 20%, colon and rectum 25%, and cervical cancer is 10%. Okay. These are the incidents of common neoplasms. Neoplasms another thing. Okay.
Mm.
Okay. Then we are entering into cancer. Actually, it is derived from Latin word cancrum, and it is equivalent to a Sanskrit term karkidakam. Hmm?
Okay. Yes,
Have
ma'am.
you heard about karkidakam?
No,
In
ma'am.
Malayalam, it's the name of a month, karkidakam. Okay,
Okay.
that
Mm.
means crab. Crab.
Oh,
Okay,
okay.
why it is known as crab? The disease so called because of swollen veins around that area.
Yes,
The
ma'am.
the cancer affected area that contain swollen veins, okay,
Yes.
that resembles crab's limbs. That's why it is known as karkidakam or crab cancer. Yes.
Ma'am.
In medical science, cancer gave the name arbuda. You are familiar with that word, arbuda. Have you heard about it?
No.
Arbuda? No, okay. Literally means the number 10 raised to 8. Then what is the reason? 10 raised to 8 means?
There's so many cells, sir.
Yes, uncontrolled proliferation of cells. Okay,
Yes.
identifying the extreme cellularity of the cancer tissue. that multiplication level is drastic multiplication. We can't control the level of multiplication. Okay, that's why the name Arbuda. Okay, so just an introduction. We must know why it is known as crab, because of these swollen veins. Okay. Hmm?
Yes, ma'am.
Then next is the definition. Cancer is defined as the disturbance of growth characterized by excessive proliferation of cells without apparent relation to the physiological demands of the organs involved. Okay, that growth is not for the physiological demand.
Yes,
Okay,
ma'am. Yes,
there is
ma'am.
without any apparent relation to the physiological demand of the organs involved. Okay,
Yes, ma'am.
Sandhya. Then oncology. We are very familiar with that department. No one wish to enter into that department. Oncology. Hmm? Except you people, MBBS students and teachers. Okay.
Yes,
Oncology deals with etiology, diagnosis, treatment, prevention, and research aspects of cancer. Huh?
mm, yes, ma'am.
Nowadays, so many research are conducted to avoid this bad disease, dangerous disease from our
Yes,
country.
ma'am.
Okay,
Yes, ma'am.
then uh, etiology of cancer. All cancers are multifactorial in origin. So many reasons are there. We don't know how it has come. They include genetic, hormonal, metabolic, physical, chemical, and environmental factors. What
Yes.
about AIDS? AIDS,
Uh,
how? Mm.
AIDS, what, ma'am?
uh, how does AIDS enter into our body? AIDS virus, it's a viral disease. Okay,
Yes, yes,
how it
ma'am.
is entered? There are three routes of transmission. Which are the three routes of transmission of AIDS?
Yes, ma'am. Three routes of transmission: body fluids,
Mhm.
uh, like blood, milk, semen, vaginal secretion;
Mhm.
sexual transmission,
Mhm.
and then fetus to mother. Sorry, baby, placenta.
Parenteral inoculation is there when we transfer
Um,
like syringes or okay, blood
yes,
transfusions like that.
yes,
Okay, when we use syringes, okay, it's very should be very careful. Okay, then next is what about in case of cancer? It is multifactorial in origin.
yes,
Okay,
ma'am.
then just different from AIDS, it's a viral disease. Cancer, it is multifactorial in origin that include genetic, hormonal, metabolic, physical, chemical, and environmental factors. Sometimes there is no bad habits for a man or woman, but
Mm,
there is a chance start they have cancer. Why? From
mm.
birth we don't know. Okay,
Oh,
that may be
yes,
genetic or hormonal. Sometimes there are some metabolic error.
mm,
Okay,
yes, ma'am.
sometimes they are exposed to some physical agents or chemical agents or environmental factors. All that things, those things leads to cancer.
Yes.
Okay, most human cancers are spontaneous. We don't know the reason. Spontaneous without any enzyme, the reaction takes place. In case of biochemistry, we explain like that. For example, creatinine formation from creatine phosphate to creatinine, there is spontaneous reaction. No enzyme is there. Like
Yes,
that, most human cancers are spontaneous. We don't know the reason. There is
reason.
no starting material or enzyme is needed for that conversion. Okay. Then cancer is the second most common cause for death. First, second only to CVD. What is CVD? Hmm?
Cardiovascular disease.
Yes, that is the first one. First common cause of death. The second most common cause for death is cancer. Okay. So all cancers are originate from one aberrant cell,
Mm,
which goes on to multiply and produce a tumor.
yes, ma'am.
Okay. Normally in our body, there are some mechanism to save that aberrant cell, to remove that, uh, problem created in that aberrant cell. Normally, okay. So many mechanisms are there, but if that aberrant cell that escape from all those mechanisms, okay, escaping mechanisms in our body, and it goes to multiply and produce a tumor. It's a pathetic condition, right?
Yes, yes, ma'am.
Okay, that's about the etiology of cancer. So what do you understand? I don't give this interactions. Okay. So what is your idea about these much points?
Cancer. Cancer is the growth of excessive proliferation of cells without any physiological demands of the organs. Then oncology, cancer means a term in Latin cancrum, Sanskrit uh, karkitakam, that which is mean crab. That is also because of swollen veins and around the area, which is like crab. And in cancer, medical science we use the term arbuda. It's, 10 power 8, 10 power 8 identify the extreme severity of cancer tissue.
Okay, then can you see which one is the most predominant cancer in our country?
Yes, in females, breast cancer, cervical cancer, and oral cancer. In males, in most common among both is oral cancer.
Yes, oral cancer. What about in developed countries?
In developed countries, breast cancer.
Okay, oral cancer is
Colon.
reduced. Okay, colon cancer is also there. Okay, so how can we avoid this colon cancer? Any tips from you? How this colon cancer forms? Okay, reason, just your idea, common idea. How can we prevent this colon cancer? One point is there in our carbohydrates. Role of dietary fibers. Dietary fibers.
Yes, ma'am.
Yes. What is the function of dietary fiber to reduce the colon rectal cancer?
Okay, yes, ma'am.
What is the function?
Dietary fibers, they
functions like a broom. Okay.
Yes,
Dietary fiber functions like a broom that flush all the unwanted materials from our colon.
Yes,
okay. If there is, we have so many junk foods like pizza, burger, and all those things. So many chemicals are enter into our body through this junk foods, Ajinomoto, and all food additives. Okay, food preservatives. So many toxic compounds are enter into our body. We know there are so many mechanisms. We already studied detoxification reactions. So some compounds that escape from this detoxification mechanism and we can't detoxify. Liver can't detoxify. So they are bind to the walls of this colon.
Yes.
Then if there is a deposition, all other compounds will start to deposit on that point, like our plaques. Plaque formation is there. Yes. So in case of colon also, all those unwanted materials start to deposit on that particular point. Okay.
Yes.
Then what happens? There is a block and that particular area start to degrade.
Yes, ma'am.
Start to degrade. Then we have to remove that particular part of intestine by surgery. Surgery is needed. In case of colon cancer, we cut the area which is affected and we reduce the length of colon, intestine. Yes. So how can we avoid this? How can we avoid this? By the usage of dietary fiber. Okay. We can add bulk amount of dietary fiber in our diet.
Right.
Okay. Yes. Can you name some dietary fiber containing food items?
Fruit, vegetables,
fruits and vegetables.
Grains, cereals.
Yes. Okay. Normally, green leafy vegetables have very effective role. Spinach. Yes. So we can add green leafy vegetables at least twice in a week. At least twice in a week. We must add green leafy vegetables.
Yes, ma'am.
Okay. Then we can avoid this colon cancer. So our diet is the major problem for colon cancer. Okay. Yes. Breast cancer, we can't do anything. Okay. Breast cancer, we can't do anything. We don't know how it comes, how it occurs. Okay.
Yes, ma'am.
So I just give you one point. Okay. Then we can enter into mutagens. What is meant by mutagens? We discuss mutations. All types of mutations are finished now. So what is
Yes.
mutagen?
That enhances the rate of mutation. The
Okay.
substances that enhance the rate of mutation.
So any substance that can increase the rate of mutation can also enhance the rate of incidence of cancer. Okay.
Yes.
So all carcinogens are mutagens. All
Yes.
mutagens are not carcinogens. All
Uh,
carcinogens are mutagens.
yes.
Okay. So X-rays, gamma rays, UV rays. Some human cancers are caused by chemicals. These may be introduced into the body by means of occupation. For example, the persons who are worked in laboratories who use this aniline and asbestos.
Mm.
Then diet that contain aflatoxins. Have you heard about aflatoxins?
Yes, ma'am.
What is it? Aflatoxin.
Uh,
Okay,
Aflatoxin.
we will discuss in detail. Aflatoxin is very important in cancer. Okay, then lifestyle. We are very familiar. Which are the lifestyles that will
Yeah.
lead to cancer? Smoking, hmm,
Yes, ma'am.
tobacco, and food additives. Usually, red color chicken is important. So
Oh,
add this color, red color, and Ajinomoto. Yeah,
oh,
and uh, then that will lead to some problems.
yeah.
Okay, always avoid food additives.
Mm.
Okay, our normal cooking procedure is very effective. If taste is less, no problem. Okay, that is good for health.
Yes, ma'am.
Okay, avoid the bad habits like smoking, tobacco using. Yes. Okay. Yeah. Cancer is a pathetic condition that will consume more money, lakhs and lakhs. Okay,
Yeah.
then the person of we can't save that person, and also the family will go into a low economic level, right?
Yes. Yes, ma'am.
After the treatment, the financial condition of the family will be very low. We
No.
can't save that person too. That is the most pathetic condition of this cancer, right?
Yes,
Okay.
ma'am.
Then we are entering into that particular term. I told you aflatoxin is there. Yes. Then
Uh,
what is this aflatoxin? It's a group of chemically related compounds synthesized by fungi, Aspergillus flavus.
mm.
Okay. It's a
Yes.
mold, Aspergillus flavus. It's a mold grown on rice, wheat, and groundnuts when kept in damp conditions.
Okay.
Okay. This fungi can grow in cattle fodder, which may enter into human body through cow's milk. Hmm.
Okay.
Okay. Milk also contain this Aspergillus flavus. Okay.
Yes.
There is a chance.
Yes,
Okay.
ma'am.
So proper boiling is very important. So
Mm.
how can we boil this milk? Just boiling and off the stove. Yes.
Yes, ma'am.
No. How the boiling is very important. We must boil our milk with at least for 5 minutes.
Yes, ma'am.
Then only we can avoid all these chemicals. There is a chance for the entry of aflatoxins into the milk.
Yes, ma'am.
Okay, so how can we avoid this? We must add water when we boil the milk. Then we have to boil that milk for at least for 5 minutes. Hmm?
Yes, ma'am.
In a same way. Okay. Then
Uh,
aflatoxins are powerful carcinogen that produces which type of cancer? Hepatoma.
mm.
Hepatoma means
Liver.
liver cancer.
Yes.
Okay, liver cancer is very dangerous. When oral cancer start with oral cancer, then it enter into liver, we can't save that person. Okay,
Okay. Mm.
when this cancer enter into liver, that is the final stage.
Okay. Yes, ma'am.
Okay, okay, that's why aflatoxin is a powerful carcinogen that directly produces this hepatoma.
Mm.
Okay, see, ma'am, so we must be careful. Okay, that's all.
Yes.
We must be careful about when taking our rice, wheat, and when store our rice, wheat, and groundnuts when kept in damp conditions that create some fungus. Then proper washing is essential when we use rice and all those things. Minimum 4 or 5 times we must wash all those things. Then when we use milk, proper boiling is essential. At least for 5 minutes we must boil. Okay, that's why we can avoid these toxins, aflatoxins. Okay.
Yes.
Then, what about cigarette smoking? You know all these points, but according to this topic, I must tell all this in points. Like, yes.
Yes. Yes.
Okay. Lung cancer that is associated with habit of smoking. Then,
Yes.
which are the deleterious substances that contain in cigarette? It's benzopyrene, nicotine, carbon monoxide, nitrogen dioxide, and carbon soot. Hmm?
Okay. Yes, ma'am.
Nowadays, cigarette smoking is reduced, right?
Mm.
Compared to the old time, it is reduced now. So
Mm.
many instruction and cinema halls and all those things that reduce the amount of persons who use the cigarettes. Okay, one cigarette reduces 10 minutes from the lifespan of individuals. Hmm?
Yes, ma'am.
10 minutes. Each and every minute is very important.
Yes, ma'am.
For us, and especially the patients will strive for the minutes when they
Yeah.
are lasting.
Yes, ma'am.
So one cigarette reduces 10 minutes from the lifespan of individuals. So non-smoking spouse, next important point, non-smoking spouse of a heavy smoker will have 5 times more probability to lung cancer than a non-smoker.
Okay. Yes, ma'am.
Okay, that's why passive smoking is injuries. No, your smoking is
Mm.
injuries to our health. Okay,
Yes, ma'am.
okay, that's
Yes.
about our cigarettes and which are the toxins, deleterious substance present in cigarette?
Benzopyrenes,
Mm,
then carbon monoxide,
mm,
nicotine, and
mm,
nitrogen dioxide.
and also soot. Okay,
Yes.
then oral cancer that is strongly associated with the chewing of tobacco.
Yes.
Tobacco. Okay. Oral cancer constitutes 20% of cancer that we already discussed. Oral cancer is the predominant cancer nowadays. Then
Mm.
next, alcohol intake. Alcohol intake also increases oral, pharyngeal, esophageal, and liver cancer. Okay.
Yes, ma'am. Yes, ma'am.
Alcoholism, chronic alcoholism will affect first to liver, fatty liver, liver cirrhosis, and finally hepatoma. Okay.
Yeah. Yes, ma'am.
Then, diet high in total fat and cholesterol. Are you vegetarian or non-vegetarian, Sandhya?
Non-vegetarian.
Okay, non-vegetarian. Then, never use vegetarian diet or
No,
mixed diet.
mixed,
Huh?
ma'am.
Mixed.
Mixed.
Okay. So, some people will take always fatty foods, right?
Yes,
They can't have their diet without the fat content.
ma'am. Yes, ma'am.
Yes.
Yeah.
So diet high in total fat and cholesterol that increases the risk of colon cancer, breast cancer, and prostate cancer. Prostate cancer is more common in males. Okay.
Yes.
Can you name the tumor marker of prostate cancer?
Uh,
Any idea?
no, ma'am.
Okay. In all these cancer, there should be a tumor marker. We will discuss in tomorrow. Tumor
Yes.
marker means we can find out the range of that cancer through this tumor marker.
Okay.
Okay. For
Yes, ma'am.
example, prostate specific antigen. Okay. One
Yes, ma'am.
particular compound is there, prostate specific antigen, PSA. Okay.
Okay.
That level will be high in case of prostate cancer.
Yes, ma'am.
So we can find out the range of that cancer through this biochemical parameter.
Yes,
Okay.
ma'am.
And that particular biochemical parameter is known as tumor marker. Okay.
Yes, ma'am.
That mark the tumor. Okay. Then next is the mouth cancer. Mouth cancer incidence rates of mouth cancer per 100,000 population in UK. You can see this mouth cancer is increases. Hmm? Then
Yes,
it
ma'am.
is the 10th most common cancer, but it is increased now, mouth cancer level. And it is the 15th most common cancer. Okay, then you know this there is an increased level. That is the most important part. So we must have a family dentist and we must clear all problems in our oral cavity. Regular checkup is essential.
Yes, ma'am.
Otherwise, that will leads to problems. Okay, we can't find it out. That's why we will discard that problem. It's okay. Then it will spread. because mouth is very important area. It is connected to all items, right?
Yes, ma'am.
Okay. If an oral cancer patient had a surgery, there must be the presence of so many doctors, dentist, maxillofacial surgeon, and neurologist because it is connected with brain. Then it is
Yes.
connected with gastro department.
Yeah.
Okay. So this mouth is a central part that is connected to so many areas. So different departments connection is essential for the treatment of oral cancer.
Yes, ma'am.
Okay. And it spread easily. Okay, because all things are connected with mouth.
Yes, ma'am.
Okay, so it is difficult to cure this disease if we can disease in early stage. Okay, first
Yes.
stage we can cure that disease, but if it is converted to second or third stage, we can't cure.
Yes, ma'am.
Okay, we can extend the life, but we can't completely cure this oral cancer. Okay. Okay, that's right. Then some chemical carcinogens that causes cancer like polycyclic aromatic hydrocarbon, benzopyrene, colantrene, dimethyl benzanthracene. You just note this benzopyrene. That's enough. Okay. So
Yes.
many chemicals. It is very difficult to study. Okay.
Yeah.
Then aromatic amines. Amines like N-methyl 4-aminoazobenzene, nitroso compound. Then you just discuss this aflatoxins and benzopyrene.
Yes, ma'am.
Okay, that's enough for you. We can remember benzopyrene is present in cigarette and aflatoxin is a toxin produced by Aspergillus flavus. It's a
Yes.
fungus.
Fungus. Yes, ma'am.
Okay, then there is a question in all smokers' mind: why only some smokers are getting cancer, not all smokers? What is the reason? Do you know that reason?
Mm,
Mm,
no, ma'am.
okay, we have also that question. Only some smokers are getting cancer, not all smokers,
Mm.
right?
Yes,
Some
ma'am.
are living no problem with their lungs are proper functioning and oh, there is no problem. Sometimes there is a small cough, that's all, and they can survive. But in some cases, they have that lung cancer. Okay,
Mm. Mm.
and
Yes, ma'am.
they got lung cancer in a very young age, for example 30 to 40 in between that age, but some people are still doing this smoking and there is no problem for them.
Yes, ma'am.
What is the reason? One enzyme is there.
Mm.
Okay, that name of that enzyme is glutathione S transferase, GST.
Mm.
Okay,
Yes,
now
ma'am.
nowadays we are very familiar with GST. Hmm?
Yes, ma'am.
But in biochemistry, it is glutathione S
Yes,
transferase. What is this glutathione?
ma'am, amino acid.
Hmm? Peptide. It's a tripeptide.
Ah,
Okay. Glutathione. We repeat that glutathione so many times. Okay. Glutathione peroxidase. What is glutathione peroxidase? Do you remember?
um, eh,
Anti
eh,
antioxidant enzyme.
yes, ma'am. Yes, ma'am.
Okay. It's a selenium containing antioxidant enzyme in our detoxification reactions and also in case of antioxidant. We discuss
Yes, ma'am.
this topic. Okay. But it is different. Here it is glutathione S
Yes,
transferase,
yes,
GST.
yes, ma'am.
Okay. This particular enzyme that is involved in the detoxification of various carcinogens, including cigarette smoke.
Mm.
Okay. 5% of population are lacking in GST.
Mm.
Okay.
Okay.
Smokers who are devoid of GST are more prone to develop lung cancer.
Okay. Yes, ma'am.
Okay. So they have lung cancer in an early stage.
Yes, ma'am. Yes, ma'am.
Okay, 30 to 40 or 20 to 30, they got lung cancer. Why? They have, they are
GST.
lacking in GST. If there is GST is present, active form of GST is present, that can
Then,
detoxify
detoxify, no lung cancer.
carcinogens, including cigarette smoking. Okay,
Yes.
smokers who are devoid of GST are more prone to develop lung cancer.
Yes, ma'am.
Okay.